a human body, right? But the way the ancient yogis looked at the human body was different. It was more holistic and it was much more integrated. And so, sometimes to blend the two is what I think yoga therapy is about. The word yoga therapy is a very modern term that has come about because we're using a lot of Western philosophy superimposed on our ancient knowledge, right? So ancient knowledge, we have the body, and the body is, you have the Atma, you have the different koshas, right? So, but in the Western system, it's looked at very differently. You have the circulatory system, the neurological system, the brain and the central nervous system. So what we want to do today is see what is the connection. Why are we even doing anatomy? If we're talking about yoga, why are we not looking at yoga from the other anatomical point of view? Which is, I think the reason we're doing that is because we live in the modern world. We have an illness and we go to the Western medicine doctor generally, right? And then we get medications and it's a very pharmaceutical, it's a very physical intervention that we get. And of course there is psychiatry that, you do counseling and stuff like that affects the mind. But really there is no system that's an effective system right now that looks at your body in a holistic way, right? So by combining the principles of yoga with what the Western, Western rishis and munis have come up with, over the years, developing Western medicine, it's really a nice way of looking at both. We have the advantage of looking at the traditional way that our culture that looked at the human body, and then now we have this way, and we can certainly blend. There is a point of connection. So yoga actually is more for preventive practice. Really, if you think about it, when in ancient times they prefer to prevent things, they prefer to make you healthy to begin with, to know how to move, and then mainly the focus. If you look at the Patanjali Yoga Sutras, there's hardly anything about physical practice. Everything in the Yoga Sutras is about the mind, and it's really, the first time I read it, I was shocked. I was thinking it's going to talk about asanas and stuff like that. But really the definition of asanas and describing all of that came so much later. What Patanjali really realized is really the mind controls the body. The body is the physical part. But before we do an action, something comes before that, and that starts from the mind. And that's what Ashwini was talking about. It starts with a desire. You see that apple, you want to get that apple. And then the mind makes the body get that apple, right? So what is the body? The body is very much a physical, tangible thing that that follows really the laws of physics. And it's a very tangible law of physics. It follows the mechanics. It follows, a lever system. If people remember physics in high school, it's a lot about mechanics. How does those mechanics work? And then there's something that connects those mechanics to some central system that gives the commands. That is the wiring of the body, the nervous system. Sends the signals to the muscles to make them contract. The muscles work on bones to make them bend, and they work on bones on a certain structure called joints, which makes the joints move. And that's how we move. And this whole thing is such an immensely coordinated system, all coordinated by the brain, really. And very much influenced by our state of mind. So we were talking about what would you say, how would yoga help diabetes? And one way of really, saying how yoga would help diabetes is it would teach, because we know that now we live in a stressful world. The incidence of diabetes has increased several times in modern times. Why? because we have more stresses. It seems like we have more stresses these days. And the way to control those, and that stress can increase cortisol levels, that stress can inhibit insulin production, so it can directly affect diabetes, right? So by doing certain yoga practices, you can affect some of that. So the way I look at yoga is, the bottom line of yoga, you should be able to sit comfortably and control your mind, and actually let your mind be controlled in that sense that it allows you to sit still, and so that you can control the mind. So it's really a circle. The mind controls the body, and the body, through the breath, can control the mind, right? So the point of learning anatomy is, the bottom line is, we are physical beings, right? Now, are all of you online to become yoga therapists? Pretty much? You want to see people and help people, or are you doing this for yourself? Put up your hand if you're going to take this further to actually to help people.
I might.
You might. So, okay. And some of you are doing it for yourself. And it's great. It's good to know that. It's good to know anatomy. So, now because the body is a physical being, everything you do and teach has consequences, right? You teach somebody a certain asana, and there's a consequence for that asana. You need to be able to know, the more anatomy you need, the more knowledge you have about how the body works, the more empowered you are to help that person. The less you know, the less you might not even know what you do, that you're doing something that's not right, or that person you're teaching is not doing something correctly and might be actually physically enjoying themselves. So the knowledge of anatomy is really, really important to be practicing effectively and in a way that is not going to hurt anybody. The Hippocratic oath that people in healthcare take is, first, do no harm. And yoga is a practice where we have to really, really inculcate that. First, do no harm, right? So that's why we need to know anatomy. For whatever, for back pain, so even if you're not being a yoga therapist, you still need to know anatomy. I think that every person teaching yoga, doing yoga, should know about their body, your body. You should know what muscles you're using. You should have a good idea about anatomy and what are the muscles you're moving, why do you need to move that, why do you need to stretch something, why do you need to do stuff. That's part of having a healthy lifestyle, and it's a basic responsibility that I actually think everybody should know that, but especially if you're a yoga teacher, you should know that. And if you're a yoga therapist, it really behooves you to really get that knowledge. So today we'll talk about anatomy in a very, very superficial way. I've been a physical therapist for 30 plus years. I'm still learning about anatomy and physiology and about the human body. So it is a work in progress.
Forget about us.
So what I'm going to do today is nothing. It's probably, I would say, 7th grade level, just basic stuff. But really the onus is on you to go to that computer and figure out, what am I going to do? What are the asanas I'm teaching? Why am I teaching it? So not only do you want your students to have a mindful practice, but as a teacher, you have to be a mindful teacher, which means you have to know what you're doing, what you're teaching, and you should know how it's affecting the body. Okay? Somebody comes to you with the back pain and says, and then you do certain postures, you do Padahastasana, maybe not a good idea, right? So you really need to know what you can do to reduce the stress on the spine to prevent something from happening. So just a basic, safety, but that's also something you owe your student to know this information. So I'm just going to go through these slides. Does anybody have any questions about why we need to know anatomy? And then again, let's also talk about what is anatomy and physiology. So physiology affects anatomy. Okay? Physiology is the action, anatomy is the noun, it's the thing. physiology is the verb. Okay, what happens? You have a human body and the prana is like the physiology. The prana is what makes things work, right? And anatomy is just a different parts of the body. If you didn't have the prana, you would be a dead body. You would be a cadaver. Cadavers have the same muscles and everything, but what makes it hum? What makes it work? That's what is physiology. So knowing both of them is really important. How something works and why it works and why you need to do, why you need to even know this subject. So let's see. So, oh, we ended up coming back down. Okay.
We tried. We tried. We'll get the sheet next time.
So I think we'll go through a little bit of yeah. So I don't know if any of you do these words sound familiar to anybody? It's regarding anything? Yeah. It can be confusing, but there is a method to the madness. And here you go. You have the parts of the pen, and then you have how the pen works. So the parts is the anatomy, and how it works is the physiology. And there is form and there is function. And there is function because there is form. Okay? And form is a physical thing. It's connected with physics, it's connected with mechanics. Everything, if you want to go from here to there, you can't fly. Your mind can go there, but there has to be a physical aspect to dealing with movement, to dealing with gravity, to dealing with everything, while you keep your body in one piece to go from A to B. And so that is the physiology part, but the anatomy part has to move forward. Kinesiology is again the study of biomechanics, about how the body works. Again, it has a lot to do with the mechanics, the biomechanics of how the body works. How does this arm? This is 2 bones, actually it's 3 bones, but how does the forearm move? Right? Because there are some muscles that are attached. There is some leverage issue that happens. Some muscle contracts and it pulls the bone, and you get flexion. Right? So that's how that works. So there is this. So again, there's all kinds of ologies. You can look it up. Urology, obstetrics, gynecology, urology. It's all the different systems that work. And this is again the Western medicine point of view. We have a different point of look. It's the same body. It's the same physiology. We just look at it differently. It doesn't mean one is right and one is wrong. They're both right. It's just how you look at it. So anatomical position is the way, again, in Western medicine you describe, in biology you describe anatomical position as how you have to have a reference point, and anatomical position is a reference point. So in the reference point, the body is standing just like you see in the picture there. That's the front and that's the back. So the terminology used, and again you can look this up, is the front and the back are, front is called anterior, back is called posterior, okay? And then you have the prone is lying on your stomach, supine is lying on your back, and then you have directional terms. So movement, we talk about movement. Now again, we're moving our body parts, and just to categorize movements and to make it more understandable, we have 3 planes of movement in general that we talk about. Okay, the one plane of movement is going this way, so basically if it's a plane, it kind of divides the body into right and left parts. That's called the sagittal plane. Okay, then there is the other plane, the other second dimension that divides your body into front and back parts. That is called the frontal plane. That's how you move this way. Okay, and then there's that part that divides your body into the upper and the lower part, which is called, and that's how the body moves. Its rotations happen in the transverse plane. So these are the 3-dimensional planes in which the body moves, and that is how it is defined in physics. In a physics class, you will have similar definitions that start with those basics of the 3 dimensions. Okay. So these are the terms that are used. Superior is up, inferior is down, and superior also is called cranial. Towards cranium is anatomy uses a lot of Latin terms. That's why they're not familiar to us. We didn't learn Latin growing up. We were more Sanskrit oriented, right? So the whole of Western medicine came from Europe, so they were well versed in Latin, and that's why a lot of anatomical terms that are used, that make it look more fancy, is really just Latin words connected. And I think we see the same thing with Sanskrit. It makes sense. It's the way you write a definition is based on the language and trying to describe one thing in reference to the other. It's a very referential kind of language. So we have the superior and inferior of cranial, and caudal means towards the tailbone. We have the ventral or anterior, which is the front, the dorsal or posterior, which is the back. So this is the ventral part of my hand, this is the dorsal part of my hand. Because we're looking at the reference like this. Your reference point is that anatomical person standing with the palms facing forward. Okay, lateral and medial. Lateral means away from the middle, medial means towards the middle. Then there's proximal and distal. So proximal is towards the center of the body, distal is away from the body. So my shoulder blade, my shoulders are proximal, my fingers are distal. They're away from the body. And then we have superficial and deep. So superficial is close to the skin, deep is close to the core, which would be in my arm, deep would be closer to the bones. In my trunk, in my body, deep would be closer to maybe inside the organs, really deep, closer to the spine, from one side, depending on which side you're going in. A body plane we talked about, the sagittal plane. Once again, the right and left, the sagittal plane, the plane is like this, so it cuts the body into the right and left side. Okay, so the movements in the sagittal plane happen in that plane. So this is called flexion, this is called extension, when you go up and down. And then when you go out and in, that's called frontal or coronal plane. It again divides, I'm repeating myself, divides the body into front and back, and then the transverse plane divides the body into up and down, upper and lower, superior and inferior. So again, the other level of biology that you hear is the body is divided into systems. Systems have organs, organs have tissues, tissues have cells. That's the simplistic way of looking at the categorization of how, another way of looking at the body, because that's what every system has. So what is a system? It's a bunch of different organs working together to do a function. To circulate blood, you have the circulatory system. You have the heart, you have all the blood vessels coming out of the heart, and then at the end of that system you have the capillaries that go out and supply the blood, and then you have the venous system. Again, the capillaries collect the blood, the veins come back, and then they feed back into the heart, and then the heart pumps it again. That's the circulatory system. So that's how, the functional organization of the body. Again, over here you have the organism level, which is the human body. It's a person, and that person, different species have different anatomies, but they have similar, similar categorization of their bodies. Then you have the organ system at the organ level, tissue level, cellular level, and then of course you have the molecular level. And a lot of things happen at the cellular level. Things go inside the cells. Everything is made up of cells in our body, and cells regenerate, cells die, and they're replaced, and that's how life goes on. And certain cells are not replaced, certain cells are replaced. But there. So now we can talk about the skeletal system. The skeletal system makes the framework of the body, right? So imagine what we would be if we didn't have bones. Anybody? We'd be like amoeba, we'd be like a blob. And you would have to like throw some part over and then we'd be like slugs, right? So with no, with no backbone. So the point of the skeletal system is to make our movement efficient, to give us a structure, to, there's lots of reasons. And then again, over here it says there are 206 bones in the body, and there are different kinds of bones. There's long bones, there's short bones, there's, all kinds of different bones. Even the skull is a flat bone, and you have the structure of the bones that are also different. So, what are the functions? Once again, framework. It gives you a framework for movement. It gives you, it protects the spinal cord, it protects the organs, it encloses everything. Again, it serves as levers, it enables us to move, and it enables us to move efficiently, to be able to, and then the bones also produce blood cells, I think, people know that. And it has a lot of minerals that it stores, which it's a storehouse. So when we are depleted in calcium, where is the extra calcium that the rest of the body need? It comes from bones. It just, so calcium, magnesium, there's a lot of minerals that are stored. So once again, these are the different types of bones that are there. You have flat bones, the skull bone, for example, so it's just a flat structure. The short bone are like the bones of the wrist. They're short bones. They're like little pebbles that fit together in a really interesting way, that at certain points they become stiff and they fit tightly, and in certain positions they fit loosely. Same thing with the ankle bones. The ankle bones inside the ankle joint, again, are made of these pebble-like, they're a little bit bigger than, of course, the wrist bones, because they take the body weight, but they also fit in a certain way where they have what is called a loose packed position, where they're a little bit loosey-goosey and they allow, and there's a reason for that. And then in a certain part, they actually fit like a puzzle piece, like a 3D puzzle piece. And they tighten up when you want to form like a lever system for the foot to take off to walk. So very, very intricately designed system, really. Then you have the sesamoid bone. A sesamoid bone is typically a bone within like a soft tissue, like your kneecap. The kneecap is a patella. That's a sesamoid bone. And then we have, I don't know why vertebra is irregular bone. It's just a special type of bone to house the spinal cord and protect the spinal cord and allow, again, not only does it protect the spinal cord, the vertebral column, it also helps with keeping your alignment and helps with movement. It forms that base of being able to sit straight, and when you sit straight, you can pay attention more. So right there's a connection between sitting straight and the mind and being able to focus on something. Axial skeleton is again, the axial means more in the center. So it's the skull that has the cranium and the face. The hyoid bone, which is the bone over here, it's a floating bone. It's like a sesamoid bone actually, which your Adam's apple, it goes up and down. There are the auditory ossicles that's deep inside your inner ear. Then the vertebral column, which is where the spinal cord is housed. Then you have your sternum, which is the chest bone. And then you have the ribs, which are, again, it houses your lungs and your heart. Again, protective function, and it has a formative function. It gives that form to your body, and especially to the lungs, to be able to be taken oxygen, and just the design of it. And then you have the appendicular skeleton, which is your limbs, your arms and your legs. And these include the connection. These are connected in the upper body. You have the shoulder blade and the shoulder girdle. The shoulder girdle is a bunch of bones that connect with each other, again, to allow the arm to move. While the shoulder girdle is different from the pelvic girdle. Okay, the pelvic girdle has the legs, the femur and the other leg bones attached to it, which allows the main body to move forward back. The reason for that, the pelvic girdle and the shoulder girdle being so different, is they have different functions in life. the arms are used to do things. We're not like with animals, you might see the arm muscles might be stronger because animals, four-legged animals, mammals, have to walk on 4 feet, right? But we walk on our hind feet. So our four limbs have been, freed to do stuff, which is why as human beings we learn a lot. We have a huge representation of our limbs and especially of our hands and fingers in our brain. And everything that we have here, the soft copy is in the brain. If something is wrong with the soft copy, well, guess what? The hard copy doesn't work very well. Okay? There's sometimes, it just doesn't. So if we don't have the soft copy there and somebody giving instructions to the soft copy to do stuff, then that message is what comes to the muscles, to the fist, and causes that mechanic to work, and that's how we move. But what always precedes a movement is some activity in the brain that is giving that order for that movement, and which is where yoga comes into.
So is that what we say marma point, or you are affecting by touching and pinching one of these? So
I'm not so sure. See, nowadays the thinking has changed. They call the gut the second brain. They say the gut has a lot of neurons. So that's why I'm saying anatomy is not a fixed. It's only as good as your understanding at that time. It's an evolving thing, and it's something that people are discovering more and more. They're finding the brain has a whole bunch of neurons and does a lot of stuff on its own. Then you have the autonomic nervous system that somebody is talking about. That's all again, So the marma, maybe it's a node, like the spinal cord has nodes from which it's like a satellite center of the brain, maybe.
Yeah.
And where something comes there, then there's a relay. It's like a relay point where then messages go from that point and then they're dispersed to wherever it's needed. And that's how the spinal cord works. And maybe the marma points are certain relay points. I don't know that there's been research on that, but one can speculate that maybe that's how, if you press a certain trigger point somewhere, it affects something else. And again, you have Indian acupressure points, same thing. Western medicine, Chinese medicine has a very similar concept as Indian medicine or Indian view.
Marma point.
Yeah. It's more ethereal. It's not so connected only to the physical form. It gives a lot of importance to the prana and to the flow of energy. So again, we have the appendicular skeleton, the shoulder girdles, and then from the shoulder girdles, the offshoots are the upper, the humerus. And then you have 2 bones in the forearm that enables you to actually turn. If it was only one bone, you wouldn't be able to turn. Think about it. Because for turning, you need a muscle that goes from this bone to that bone. That muscle needs to contract, and then the outer bone, the radius, comes over the ulna. And think of how much we have to use this. People who are here working in your computers, you're using this a lot. So it's a pretty interesting design, really, to allow that distal part. So the proximal part, which is closer to the axial skeleton, is the stabilizer, it's the anchor. And the distal part is the mover in general. It's what makes you do stuff. But if you don't have a good, strong proximal part, if you don't have an anchor, you're going all the way, And there are a lot of conditions that affect the proximal part. People have hypotonia, people have neurological conditions where they cannot stabilize here. And you see, they have a huge problem with coordination. They cannot write, they may not be able to eat properly. You see a lot of people with disabilities because somehow something happened where maybe they didn't develop a certain part as well, so they don't get that stability. Then you have the pelvic girdle, which is again, so the shoulder girdle is an interesting, it's a very interesting way it's designed. You have the scapula, which are the shoulder blades, which are like, actually the scapula is a floating bone. It's an interesting, so if you don't have good muscles in the scapula, and it's only connected to the main skeleton by muscles. And then, so it's just this bone, and then it's got these, it's connected to the collarbone, And at that junction, that's where the shoulder fits. Okay? And then you have the shoulder joint is made over there, and it's made that way because it's meant to be very mobile. It's meant to have a big range of motion. So I'm using these terms, so I'll use these terms again later. Okay, the range of motion, and so you can move around and reach different places, and then so that's the way it's designed. It's not designed that much to walk.
So where is scapula, if we touch?
The scapula is right in the back.
Yeah. So but you were talking about the front.
This is the collarbone,
Okay.
the clavicle. And then the clavicle is connected to your chest bone. It's called the sternum. Right? So then you have the pelvic girdle. So again, you know the names, the radius, ulna. I think if I can keep telling you the names, you're not going to remember it. So I think after this you should go, and it's good to know the terminology, but more than that, it's good to know that there are two bones. It's not one bone, it's two bones. And anything that moves has to have muscles, has to have a lever system working, has to have some kind of mechanics that makes it work in a certain way. Right? And certainly go up and look up these terms, the femur, the fibula, the tibia, the patella. All of these are words, a lot of these words are not familiar to us because they are again Latin derivatives. They're from Latin, so people don't know them, but it's not a rocket science, it's just a terminology, just a language.
Will you be sharing this slide?
Yeah. Not only that, you will also be asked questions, quiz, so we will make sure they remember all these
That's
words.
good.
Yeah, so so these are all the major bones of the body. There are a total of 206 bones, so I'm not going to name them. But there are some bones that you should know, and we can talk about that, it's good to know. But when you're talking to somebody who's a student, you don't have to use jargon. You have to make yourself understood. You have to know it. So whether you know that the shoulder blade is called scapula or not, I don't know how important that is. It's good to know, because when you're talking to somebody else or a medical person and you're a yoga therapist, they're probably going to expect you to know this terminology, because that's the common language. But if you're seeing a person, you're seeing a student or a patient, you can say move your shoulder blade. You don't have to say move your scapula and let's do this to your clavicle. You don't. Yeah. So it's really important to know what they are, the concepts, rather than the terminology. You can read up, and if you're going to be writing a paper, then yeah, please write terminology.
And that slide out there is exactly the subject of questions and quiz. So you will be asked
Yeah.
the
So
questions.
I am definitely not going to go through this. I expect that you guys are going to look it up. What we're doing is I'm hoping that we will inspire you to do way more, go deep into this. When you see somebody, you say, oh my God, this person has pain in the shoulders. So instead of doing something right there, I would encourage you to say, go look it up, see what's, because you're not going to remember everything, right? So look it up, say, what is this? What's going on? What are the parts that I'm treating? Or what are the parts I'm addressing? And why is this person having pain? And find out, look at the anatomy, and maybe something is getting pinched over there. So you need to say, oh, okay, so these are the muscles in that area, these are the bones, because we are treating, all said and done, when we're doing we're doing yoga asanas. Asanas are physical. Pranayamas are also physical. There's a breathing mechanism. If you don't have that basic mechanism, you cannot do pranayamas. An amoeba has limited capacity to do pranayamas. Okay? So we need to understand that, and that is the very basic stuff that we need to know. So these are the bones. So again, the upper bones are named differently. They just wanted to confuse everybody. So be confused, but learn it. Okay, joints. What's a joint? A joint is fulcrum. Physics. Any physics graduates here?
You studied physics.
Bunch of engineers, right?
Yeah.
So it's a fulcrum, and there's an axis around which the fulcrum works. It's as simple as that. So when the door opens, there's that joint, okay, and the door opens and closes around the fulcrum, and there's an axis around which it moves. That's all the body is made of. All movements have to do with something pulling something and causing movement. So what is pulling what? Usually muscles are pulling on the bones, and then the bones move. Now if one bone moves, it's connected to another bone, guess what? That's going to impact that other bone too. That's all it is. The body is all connections. You have your foot bone is connected to you. There's a song. Anybody knows that song?
The knee bone's connected to
That's the one. Yeah.
Yeah, that one.
So yeah. So everything is connected. So when you move your big toe, it actually impacts probably your whole body. It impacts your balance. You may think, you're standing and you just pick your big toe up and you stand, and then you put your big toe down and you stand, you will experience a difference. People who've had amputations, who've had their toes cut off, walk very differently than people who haven't. And that's just a small part, right? But everything affects everything. Yeah. So a joint is an articulation. It's described as a union of two or more bones. Okay? So you have one bone and you have another bone. Okay? Simple definition. And this joint moves. Then based on so maybe you have the main bone and then you have like a cup. I'm just giving an example. And if the cup is really restrictive, it might only allow the movement to happen in one plane, in one motion. But if the cup is a little bit more open, it might allow more planes of motion. So that's all the joint is. It's a very mechanical thing. It's two bones connecting to each other. And then the muscles start on one bone and overlap and pass that joint and go to the other bone. And when the muscles contract, it causes movement. But it causes movement according to how the joint is structured. What a joint has is it has two bones, and then it has a capsule. What's a capsule? A capsule is like cling wrap connecting the two bones. It's literally like cling wrap. And within the cling wrap, there is where the joints both are going to move against each other. If that happens all the time, we're going to get worn out bones. So we need to have washers over there. The washers allow, and shock absorbers. The washers allow a smoother movement. It smoothens out the movement. And then those washers also secrete certain nutrients that feeds and maintains the health inside the joint and allows that movement to happen smoothly. When somebody gets arthritis, the washers are, so washers are also cartilage. So the bones are lined with cartilage. Cartilage are like washers. And when they get worn out, somebody gets arthritis. Then the bones start becoming raw and start forming what's called osteophytes, and they start hurting. So when you're seeing somebody with really bad knee arthritis and you choose a whole bunch of standing activities for them, guess what? It may not fly very well. It might increase their pain. So you may have to look at that person and say, okay, really bad knee arthritis, what can I do for this person that they can still do the yoga? Because they want to do yoga, they want to maximize their health. They want to be able to sit in a certain position, maybe to do meditation, and they can't. So now, and then sitting still, again, that's another problem with arthritis, right? So that's how you have that connection between an intact anatomy and a non-intact anatomy. It very much bears on your choice of what you want them to do in that class. And then there's the capsule. It's made of connective tissue. So the body tissues, as far as movement is concerned, is made of a couple of types of tissue. You have the muscle tissue, which actually moves and changes length. Okay? Then you have connective tissues of different strengths and different structures, slightly different, that have different functions. Some connective tissues are more rigid, that hold, say the capsule, hold something in place. You have the capsule. Then you have ligaments that further protect the joint and prevent the person from going in a wrong direction. If the joint is meant to go only in the sagittal plane, okay, so going into flexion and extension, then there are ligaments that support them on the sides that don't allow this movement to happen at that joint. Now, this movement does happen, but it may not be coming from the elbow, it may be coming from somewhere else. For example, when you do this movement is coming from the elbow joint. But when you do this movement is actually coming from the shoulder joint. Because the elbow joint does not have this rotation. The elbow joint, in fact the forearm has this, and this is a different type of joint. Okay, it's the two bones connected again, which allow this one to move. So, so that is how the joints are structured. They have different layers of protection and that make that joint more efficient in its movement and that make that joint more smooth in its movement. So the movement happens smoothly without any pain. So there's a very much structural component to doing, so when we're doing a yoga and we want something to move slowly, you know, if you're dealing with a healthy body, it's different from moving with a body that has been affected in that part with some kind of ailment that they can't do that.
Is it possible to distinguish between a pain because of cartilage issues versus true arthritic pain?
Cartilage, that's a tough question because, for example, if you have the knee cartilage, the meniscus, right? If the meniscus is worn off, right? Then that's what causes the
That's
but that would be much worse. Probably the arthritis pain would be worse. But for example, if the meniscus is torn and a part of that tissue of the meniscus comes inside the joint, like it, you know, then you'll have a different type. You might hear a clicking sound. It may not hurt. It may or may not hurt. The hurt point happens usually when it reaches the bone level. And so it can be, mostly it can be, so someone might say, you know, you have pain in the knee and the doctor might say they have arthritis and they do an x-ray and it doesn't show arthritis. Why is that person still having pain in the knee, right? They may be having swelling in the knee. They may be having, say, a rheumatoid arthritis or some swelling for whatever reason. But even though they didn't have arthritis, there are different reasons for the pain. It really depends on the history of the patient. When the pain started, why it started, did something trigger it versus did it start slowly?
So I'm talking from a yoga teacher perspective. If if your student comes in and tells you, I have pain, but they have not been to the doctor and they don't know whether they have arthritis or not.
Yeah.
They say, I just have knee pain.
Yeah.
How are you supposed to sort of make sure that you do not make it worse without knowing whether it is arthritis or not?
So now the pain can be from soreness, the pain can be, you have to analyze the situation to see, first of all, and secondly, you have to understand you're not a diagnostician.
Exactly, yeah.
So you really have to say, you know something, you tried this and it's giving you sharp pain or this kind of pain, you need to go see a doctor. You need to direct them to see a doctor to say, you can suspect that they have something going on in the knee. Do you need to do the differential diagnosis of whether it is arthritis versus a meniscal tear? I don't think so. You say no, and you shouldn't. Because what if you say, you have a lot of influence on the people you treat, and they're going to say, what do you think it is, right? And they're going to say, oh, you know, you bias them and say, okay, maybe it's, I think it looks like a meniscal tear. That's really not, you know, the doctors really are trained to be able to say what it is. They may do imaging studies to confirm that, versus you might put this person to a lot of anxiety, saying that I think you have this really bad thing going on, my God, you know, blah, 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 and then turns out the doctor says there's nothing really wrong with them. So that's not even an ethical thing to do. The best thing to do is refer to whoever is the expert in that area.
So
Someone has a pain.
From a yoga teacher perspective, in the absence of a full diagnosis,
Yeah.
you probably should take the position that it is the worst possible and not make it take the safest possible choice of asanas for the person.
Yeah, I think you have to modify your asanas.
Right.
And you might have to have them sit out a certain asana, or
That's
you
right.
might have to say, okay, do this like, you know, back pain, and you're having them do Padhastasana, right? So what do? You say, you know what, let's modify it, let's bend your knees so that doesn't put that much pressure on your back, right? And then if they still have the problem, you have to modify it further. you have to say, okay, maybe they're not a good candidate to do the Surya Namaskar if they're having this really intense pain. And you don't really know where the pain is coming from. What if they bend their knees and do everything and they still have some pain coming down? Maybe something going on in the hips, maybe the piriformis, you don't know what's going on. And at that point you have to say, don't sit out this one and do something that suits them. So you really have to have that eye for what is good for each person. So especially as yoga therapists, I do not believe a yoga therapist should have a class of 50 people. I think that's scary. I think a yoga therapist ideally should be one-on-one, because you are helping one person, you're helping analyze them, and you're tweaking them where they need to be tweaked. So you need to come there with your knowledge. It's hard to be controlling. Maybe you could do 2 people, maybe you could do 4, pushing it a little bit. If you know them really well, you could do that. And then these are the major joints. There are different kinds of joints. There is the flat joint, and flat joint is like like the pebbles of the wrist and the pebbles of the feet and ankle. They have usually flat. They're congruent. They're a little bit. They're pretty much flat. So they kind of move between each other. They don't necessarily have one muscle going from one bone to another. They're just connected by different kinds of, they may have some cartilage and they may have some ligaments connecting them, and they just allow for certain movements. And in certain positions they become tightly packed, and in certain positions they become loosely packed. And those are depending on the function and what you're using that for. So those are the flat bones. The trochlear joint is again the elbow joint. The elbow joint allows it's like something is moving like this. So it goes into this position and this. It does not allow this movement. It is restricted. The shape of the joint, the structure of the joint restricts how the joint moves and how much it moves. The range of motion is how much a joint can move. In what direction and in what plane. That's how it is defined, the range of motion. Then you have the socket joints. This is a ball and socket joint. There's a ball and there's a socket. And the hip joint is another example of a ball and socket joint, where the movement, you move into flexion, extension, and then you have some abduction, and then you have some rotation. So the shoulder joint has all the 3-dimensional movements. It has movement in the sagittal plane. This is called flexion, bending. Extension is going away backwards. Okay? And then you have the movement in the frontal plane, which divides the body into the front and the back, which is called abduction, away from the body. AB is away, and adduction is towards the body, towards the midline. Then you have the rotation. You have the external rotation, or some people call it lateral rotation. Lateral is away from the body. Okay, external is also external rotation. You have internal rotation. That comes from the shoulder joint. And then there is one joint in the thumb. It's called a saddle joint. It's like an F shape, and it allows this combination of movements that comes from the joint, from the thumb, from the base of the thumb. Again, a fibrous connective tissue, you have a fibrous joint. For example, the joint over here between the forearm bones, the outside bone is called the radius, the inside bone is called the ulna, and they're connected with the fibrous tissue, which is connective tissue, which has more fibers, and so they remain connected to each other, but they're loose enough to allow one bone to overlap the other, and they can tighten up when you go the other way. So that allows the movement. So some of these joints there are some muscles that do go across and move it over, but the actual 2 bones have to move over and then they have to open up. So they actually move over and they open up. So one bone actually overlaps when you're rotating your hand in one direction, when you turn your palm down, and then it de-rotates when you turn it up. Okay? The cartilaginous joints are, again, you have the spinal cord. They are the cartilaginous joint. There's not that much movement, but there's some movement. and they're separated. The spinal cord is made up of a bunch of, bricks with holes, okay, with certain shapes. Based on where they are in the body, they have slightly different shapes. But the spinal cord goes through those holes, and you can imagine these bricks are stacked up one on top of the other, but they're separated by the discs, which is cartilaginous, by intervertebral discs. And because that space between them, that's why the reason it's like this is the gaps between the bones is where the nerves come out. The nerves that ultimately they come out from the spinal cord to then supply, that's the whole wiring system of the body that end up supplying all the different muscles and organs of the body. Okay, and then you have the synovial joints. These are more like your knee joint is a synovial joint. It has a lining which keeps secreting. It's this capsule. It's encapsulated in this cling wrap thingy, and then it has a lining that secretes the synovial fluid, which helps to nourish the joint and helps to lubricate the joint. And then so it smoothens out the movement of the joint. Major muscles of the body. Oh my God.
And that's the list. That
That's
list
the
you
list.
have to remember.
But, you have some major bones. You have the trapezius muscle that can get really, if people are doing this, they really need to bring that down. There are just too many muscles to talk about here, but trapezius there. Then you have the pectoralis muscles. Okay, those are the chest muscles. You have the muscles in the back. The trapezius is also in the back, but there are some other. These are more of the superficial muscles, but they're big fat muscles that do lots of big fat movements. Then you have, of course, the abdominal muscles. There are different layers of abdominal muscles. There are the intercostal muscles. Those are the muscles between the ribs that help to flare the ribs and unflare the ribs, to change the dimension of your chest cavity so that you can breathe, so that air gets into the lungs and then air is expelled out of the lungs. Then you have, of course, your other arm muscles. You have your triceps, your biceps. You have all the muscles for the hand that actually. So muscles always. So anything that, for example, something that moves the hand, the muscles are going to originate. It's called originate. A muscle has an origin and an insertion, which nowadays people are again changing that concept a little bit. But basically, muscle has two ends, and the middle part of the muscle changes its length. That's the muscle fibers actually. But the ends of the muscle, the two ends of the muscles are usually cartilaginous tissues. So you have a muscle with ends with a tendon that inserts into a bone, and the tendon is like a rope. The rope does not change in length, but the pull on the rope, when you pull on the rope, the muscle causes the pull on the rope, which causes the movement. So muscle is always what we call proximal to the joint, usually. It's on one end, and then the tendon usually you can cross the joint and attach to the other side of the joint and then pull on the bone on the other side to cause that movement. So it is again a fulcrum system. There's an axis and a fulcrum, and that is powered by the muscle and the structure of the muscle. So you have the gluteus maximus, important muscle to know about. The abdominals, there are 4 layers of abdominal muscles you should know about that. And then you have, of course, the
Sriram will
quadriceps.
conduct a whole workshop on core. Yes, this core
Okay.
anatomy.
Okay, good. And then you have the calf muscles. Then 2 sets of calf muscles, the hamstrings and the back of the thigh. So everything has muscles in our body. Even an organ has muscles. You have skeletal muscles, which are connected to the skeletons and are more voluntary muscles, which means they need usually a conscious, or sometimes it becomes automatic at some point. Walking is more automatic, but it still is made up of skeletal muscles that work in coordination with each other to create walking, right? But even our organs are made of muscles. Everything in the brain, in the body is made of muscles. You talk, it's muscles. You breathe, it's muscles. Your organ, you have glandular system that secretes hormones to regulate the body function. Even those, when those glands, they have smooth muscles that have to contract to excrete the hormones or whatever whatever their function is. The bladder is muscles, the uterus is muscles, everything is muscles in the body. Just certain muscles you can control better, smooth muscles are harder to control.
So we are basically calling tissues as muscles, is that right?
No, tissues is tissue, everything is made of tissue. There's muscle tissue, there's connective tissue, there's blood is a tissue, there's skin is a tissue. So tissues are, cells get together, same type of cells get together and form a tissue. And then those tissues form an organ. So tissues, it's a different equivalency that you see. It's a different level. Muscles is a type of tissue. Muscle tissue is a tissue that's contractile. Fibrous tissue is different. It doesn't move, but it has strength. Again, now we have the spine. The spine is a complicated structure. The spine, the brain and the spinal cord, you have the brain, which is the central nervous system, and the spinal cord is the continuation of the brain that comes down, ends up in the, it ends up in the, it's like the tail. The one part of the brain is the caudal part, the end part is called the cephalic part, and then the caudal part is the tail part. That is the spinal cord comes down. And the spinal cord needs a lot of protection, so it is housed in the vertebral column. So the vertebral column is not the spine. The spine and the vertebral column are actually separate. The spine is housed in the vertebral column. And the spine shoots off these different nerves at different levels. And those nerves come out in the gap between the bones. And then they branch out to supply whatever they have to supply. Okay, so you have the vertebral column you have the connected to the skull. After the skull, you have the cervical vertebral column. There's 7 cervical vertebrae, all stacked on each other and giving it a certain shape. Then you have the thoracic vertebra, so the cervical vertebrae, for example, are designed for movement. You have to be able to bend your head, turn, and so flexion and extension in the sagittal plane, right? Then you do, this is called side flexion or lateral flexion, back to the center, lateral flexion, back to the center. That's in the frontal plane. And then you have the rotation. The rotation is in the transverse plane. So all of these movements are a combination of movement of the 7 vertebrae moving between each other. And even within the cervical spine, the top vertebrae have slightly different function than the bottom vertebrae. But, and then, so the weight of the head is passed on through the vertebra, through the cervical vertebrae. And then you have the thoracic vertebrae, which don't move much, but they form the anchor for the ribs. They form a very strong anchor for the ribs between the thoracic vertebrae and the sternum, which is the chest bone. You have the ribs are connecting them. And the ribs have movement, so they also have to hinge at 12 different joints on each side to be able to move up and down. Okay, and we will learn about that, right? The bucket handle movement and different dimensions of the chest cavity that makes breathing possible. And then you have the lumbar vertebrae, which are, as you go down, you see the vertebrae become thicker and thicker because they're taking more and more weight, and so they are designed for that, and they ultimately end up sitting on the sacrum. And the sacrum is really a fusion of 4 bones together, and they form this solid structure. And then connected to this is the pelvic girdle. You have, this, again, that's another, we're sitting on our pelvic girdle. It's a strong, strong bone there, and if we sit correctly, we sit on our sit bones. It's called the ischiums. If we don't sit, if we sit back, we maybe do what we call sacral sitting. And sacral sitting can happen when you have, when you're just plain lazy, or it can happen when you're tired, or it can happen when you have, tight hamstrings, for example, because the hamstrings are attached. to that bone that we sit on. And it can, if it's tight, it pulls it forward like this, the bottom part is pulled, so you end up hanging back because the hamstrings are tight. So if you're doing Dandasana and you have tight hamstrings, guess what? You're going to sit like this. It's hard to sit straight with tight hamstrings in Dandasana. Okay? And that can put pressure on the vertebrae. It compresses. Everything that we do, flexion and extension, compresses the discs. The discs in between the vertebrae are a little bit cushiony in the center. Okay? And again, they're like big washers with some nice cushioning in the gel cushion in the center that allow for the shock absorption. And sometimes, if there's some problem, and I don't know if they're talking about if we have something on the structure of the discs.
We'll be doing one whole spine and core anatomy.
Okay. So this is just an overview, but there's just a whole lot of stuff to know about this. Again, there you go. Here are the discs. You have a normal disc which has a certain height and it has a certain structure. It's like a ring structure, cartilaginous outer ring, and inside there's this gelatin-like structure that where the forces goes through and it gets absorbed. It gets absorbed. There's shock absorption that happens, and sometimes that system, when the intervertebral disc is degenerating, that fluid or that gel can leak out and it can hit a nerve that's exiting out, and that can cause a herniated disc. When you hear about that, it's because there's been a breach in the ring which opens up, and then something comes out or it dries up, and then you start getting back pain. And you can see as you go, you have a really good normal disc at the top, and as you come down, you have a bulging disc somewhere there. There's a herniated disc which is completely out, the inside part, and then it can thin down because it dries up. Okay, and finally it can really degenerate to the point where it's bone on bone or really bad, and you see all these rough edges of the vertebrae are called osteophytes. And these are painful, and one osteophyte rubbing against another one can cause pain. And then there's also the disc. You have this is the vertebral column, that's the body, the vertebra, and then it has two arches that come out, and then they connect with each other, and that's where the spinal cord goes through. And when those arches come out, over there, the lower arch connects with the upper arch to form a facet joint, and that forms a hole. So this one, the lower facet joint and the upper one, they form a hole through which the nerve comes out. Sometimes you have problems here in this joint, and that causes a lot of pain also. It can be painful.
So you said the nerves come out here in the middle?
No,
Here?
no. So you have one bone and another bone,
Yeah.
right? They're separated. So the spinal cord, say the bone is it's like this.
Yeah.
Spinal cord goes through there.
Mhm.
So at every level, so seven, this 7 cervical vertebrae, right? So C1, 2, a bunch of nerves will come out through that hole,
Yeah.
okay? And then they branch out to go wherever, to go to the different muscles.
Yeah.
So that hole through which they come out is the facet joint. It's made by the arch of the top vertebrae and the arch of the bottom vertebrae. It forms a wall. We don't have a picture here, unfortunately. I don't think.
Do the next, maybe.
Okay. So
No.
we talked about this.
No, I thought there is one picture like that, but there isn't. Yeah. Because we are moving the whole thing to the spine anatomy.
Okay. Yeah.
Otherwise,
I mean, there's a lot
no-
more. You learn a lot more when you come to that unit. To the spinal cord, you have to know the anatomy and exactly what happens, what comes through, and what is normal anatomy and what can be a problem, what can be something that can cause pain or dysfunction. Okay. And then we have the body movements again, where you have flexion, extension, we talked about that. Sagittal plane is flexion and extension. And then you have the frontal plane, abduction, adduction, and then you have rotations in the transverse plane. Again, I'm repeating myself. It's good though, because it's good for you to become familiar with these words, and hopefully they'll ring a bell when you read more about it and study further on that. What is this?
The feet and the hands.
So there are some anomalies, of course. There's always exceptions to every rule, right? So you have the movement of the feet. You have flexion, dorsiflexion, and this is extension, but it's called plantar flexion. Okay, when the foot moves up and down. And then you have this part is actually not called abduction, adduction necessarily. It's called inversion because the foot slightly turns. So it's really a multi-dimensional movement, but because it's a little bit combination, they've given it a different name called inversion, meaning the foot is turning inwards, not just moving inwards. This is more, so this one, because it turns, it's inversion, and because it turns the other way, it's eversion. So there are a few slightly different, even the because the thumb is a saddle joint, it has opposition, it goes this way, because the thumb has flexion, extension, it has adduction, abduction, and then it has opposition. So it's a combination of going a little bit into adduction, going a little bit even into abduction, some adduction, and then some rotation. And that happens at this joint, for it to reach the fingers, for you to do something. The thumb is a special joint. So again, organs, we have of course the organ system. The different organs are housed in different cavities. All the organs are pretty much in our trunk. They're separated by what's enclosed in the rib cage and what's below the rib cage, separated by the diaphragm. Okay, there is no, the connection between the chest chamber and the abdominal chamber, that's called the abdominal, that's the abdomen, that's the chest. The connection is only through, you have the blood vessels piercing through the diaphragm. Okay, what is a diaphragm? It's a sheet of muscles and it is dome shaped. It's a very, very special muscle. This is one muscle that has, it is sort of connected to a lot of structures, not only to the bones, it's connected to the ribs all around. Okay, and then it descends and it connects to what's called a central tendon. That's this thick structure of, it's not a bone. Okay, it kind of merges into each other, but it's the center of it is called a central tendon. It's not a muscle part. That's a very more connective tissue part, which is thick and strong. And the diaphragm is very, very influential in breathing, obviously. So somebody with the paralyzed diaphragm can have, and the diaphragm has a certain nerve that supplies it, and sometimes that nerve can get affected, or the diaphragm can get affected due to different conditions, and that can cause paralysis of the lungs. That lower part of the lungs won't work, and then people have to do something different to breathe for that. So it's a pretty serious condition. But the diaphragm separates the organs and the upper chamber to the organs from the lower chamber. The upper chamber organs are, of course, the heart and the lungs mainly, and all the major blood vessels that come out of them, right? Then you have, of course, the brain is housed in the skull, and then you have all the major arteries going and the nerves passing through the neck to go to that connection between them. So the neck has a whole bunch of muscles, but the neck also has a whole bunch of nerves and arteries and veins that connect to the brain. So the heart and the brain have to be connected for the blood supply to the brain, and then you have to have the nerves coming through. Most of the nerves come through the spinal cord, but there are 12 pairs of cranial nerves that come out directly from the brain to connect to the ears and the eyes and the nose and the tongue and also to the throat. And then you have the vagus nerve, which is a very, very important nerve to know about, which is part of the autonomic nervous system, which connects to the whole gut, to the whole GI system, and to a lot of the organs that have autonomic function. Okay, that secrete different hormones and stuff like that. And then you have, of course, inside the abdominal cavity, you have a whole bunch of important organs. You have the liver on the right. You see the liver there, huge, big old
number 6
organ, number 6. Then you have the spleen, it's tucked away on the side. Then you have the stomach.
5, right? Number 5. Spleen is number 5.
That looks like the stomach, doesn't it?
Stomach.
Yes, the spleen is tucked away from
Okay.
the side. And then of course then you have the whole GI system, the gastrointestinal system, which is again the whole system of digestion, which is a very important system in yoga again. And not only does it have functions to get nutrition into the body and to eliminate food, which is the basic, need for life other than oxygen, but it also does a lot of secretive functions. It's got a lot of functions. That's why nowadays they're calling the gut the second brain. And I think the gut has a huge part to play in Ayurveda. They believe everything starts from the gut. If you don't have good digestion, it messes up everything. Because everything that you have in the body comes through the GI system. It's regulated through that. If something is wrong with that, then you won't get the right nutrition or it'll get. And then of course you have, so the GI system goes into the small intestines and then into the large intestines. Then there are some accessory organs that include the pancreas that secrete insulin. And and then so all of these organs have different functions to regulate different functions of the body and different tissues in the body. You have the bladder, and then all the sexual organs are all housed in the lower part of the abdomen. Kidneys, of course, are also there. Did I miss any organ? So we have the diaphragm. So the abdominal cavity has a diaphragm on top, and it has the pelvic diaphragm or the pelvic floor at the bottom. Okay, so it really is like a closed chamber. It doesn't breathe. So when you say breathe into your stomach, it's more metaphorical. It's not literal. Okay, when you say breathe into the stomach, it still can connect with people. You can have them imagine. You use a little bit of imagination to explain what you're going to do. So the way you explain what you're doing in yoga is very important for them to control. The brain always thinks in terms of function. Okay? The brain is not thinking, now let me flex my hand and get my comb. The brain is thinking, let me get that comb. Okay? So you want to keep so you don't want to say, if you can avoid saying, okay, now pull in, you can say pull in your abdomen. You can say, squeeze your butt a little bit. You can say some words like that. But in general, you're not going to say, okay, use your biceps. What does that mean, right? So it's a very holistic. When you say holistic, we're talking functional. We're talking about, I need to reach that bulb to do whatever. So whatever muscles are needed, the brain figures that out and executes that. So those are the organs. Okay, function of the organs. So this is there are these little glands that regulate function in everywhere in the body. Starting with the top, you have the salivary glands that secrete saliva into the mouth, keeps the mouth moist, keeps it, the mouth is the entry to the rest of the world. And it's a gateway to where you can get a lot of diseases. Why don't we get so many diseases? Because the salivary glands, a lot of protections within the mouth, the lining of the mouth, that helps, regulate all of that. And then you have the esophagus, which, okay. So these are all the, organs. We talked about the liver, the spleen, and they all have different functions. And of course, doing yoga can affect a lot of them. Some of the effects are mechanical, when you're actually compressing an organ and you're doing extension and you're opening up the organ, and that may help to the blood flow to the organ to make it function better. And some of it is regulating through your breath, through your brain. It tells a certain organ to say, hey, calm down, don't secrete so much endorphins, or don't secrete so much ACTH. So the pituitary glands and all of those glands are also glands that function a lot with the brain, directly from brain, messages from the brain. Okay, so organism, I'm not going to go into that. Oh, we're done. Any questions?
We have to read more.
Yeah, exactly. So this is a it's a very general overview. This is really biology 101 that you do in, in 7th grade or something, where you just know a little bit about how the body works, so just some general, which we all know, so it's just an overview, but we would have to touch on each of these systems as we go through each of them. The nervous system, the autonomic nervous system, the musculoskeletal system, the neuromuscular system, the glandular system, the GI system, all of these systems that impact yoga.
So in the spine, when those discs kind of get degenerated, can that be undone in any way?
What they're doing, nowadays they do the stem cell, they're trying different things now to regulate that. And I had a patient who had this disease, and at the age of 43, she had all her discs were degenerated. So she ended up going to some institute in Colorado and got stem cells done that is now building, so that, the stem cells before they're differentiated. So when they are put in a certain position, so that's how the body develops, right? Human growth and development happens, all the cells come from that zygote that's formed, right? That's one cell, and that's one particular type of cell. It's amazing how when that, multiplies, then cells gang up on each other and become similar, homogeneous to become a tissue. So the stem at that level, it's undifferentiated. So they use that concept of undifferentiated, and they try to evoke the DNA code, or I don't know what they do, but something like that, that forms that cartilage cell that can regrow that in that area. So it is working. It's still, it's not perfect right now, but people are actually doing it. But yeah, other than that, no. The surgery that they do, just snip it off. They decompress. Sometimes they put something, they wedge something between the bones to keep the gap, because the gap is very important. Otherwise, all the spinal cord will get compressed and cause problems.
Okay, thank you.
Thank you.
Thank you.
So we have that Tadasana, and in fact, Jyoti also can help us in that. So can you open that sheet? Let's discuss. There are two practices. One is the regular Tadasana, and then we talked about the Samasthiti also. We'll practice both. So can the light be on so that we can... So in Tadasana, can you make sure that the video is okay with that? All of you can actually hold on to the paper and maybe come to a standing position also, if possible. Or first let's discuss and then you can stand. First let's just go over the notes. This is one of the basic poses, right? Tadasana is one of the basic poses. And we also use this as a central practice in cyclic meditation. We'll be doing a workshop on cyclic meditation tomorrow. How to make sure the feet are rightly placed on the floor. To bring awareness, one can do centering practice. We do that. That is slightly bringing the balance, the weight towards the front and back and to the side and so forth. So that you eventually develop correct balance. How to place the feet. One can place the feet slightly apart for better balance, which is the Tadasana that we usually nowadays. Jyoti can correct me wherever I'm anatomically, if there is anything that
wrong. The body allows you to do that, do it.
Yeah. Okay. No. Through the whole process, if you come across something, we keep the feet slightly apart. Some schools even suggest keeping the toes hip width apart. And I have even pointed to who that is. He's John Schumacher. He's a disciple of Iyengar. And but in advanced poses, Tadasana is done with feet and toes together, heels and toes together. So we'll work on that. Srivatsara Ramaswamy's book. That's another thing that it will be nice to have and work with that. In simple Tadasana, there is a slight internal rotation at the hip joint. Eka is going to conduct that anyway. placing a little block will be, by the way, you're all required to buy a block if you don't have one. This weekend, she's not around, but there will be sessions by Ika and Sriram as well. And even otherwise also we'll be using blocks where necessary.
Reference what size?
The usual
The thick
Can you
Yeah.
just buy and be paid? That's,
Can we buy and pay?
just order everybody.
Yeah, one of you can, because most of you may even have, so I don't know.
Oh.
I have.
Yeah, see, that's the problem. Anyway, have a block, and if you place a block, we don't have right now, right here, right at the upper thigh, and squeeze. Yeah, you have a block?
Yes, yeah.
Okay, next time we'll try this anyway. We probably want it like that, right? If you place like that and stand like that, right? All the way up. This is also probably not the right
You
one.
want the thicker one.
Thicker one. We need a thicker one. Okay? And that's how we want to place actually, with a thicker one. This is too thin. Then when you squeeze this, right? What happens? There is a slide. Very slight, I'm just overdoing this, so don't overdo any of these. So what happens when you squeeze? You squeeze like that, right? That's the feeling you should have when you stand in Tadasana. So very, very light. All of these are so subtle and so little that you don't want to overdo any of these. Because if you did like this, you are going to be in trouble. So just a very slight movement, a little slight internal rotation there at the hip joint. Whereas in case of Vinyasa Samasthiti, when you join them, and he says nudge the pelvis forward, what exactly happens? The opposite effect. We see the opposite effect. You will be trying all of these things, so don't worry about it. How to engage the thighs, like we talked about that, place a block. And also very slight, as I said, internal rotation. I may be wrong, I may be right. These are all cheat sheets, meaning it's a live document, subject to debate, and we can always work on it. There are so many discussions on all these various positions and anatomical positions. That's why we don't get lost in these things. We don't want to get into too much of a debate in this because there's no end to it. But the whole idea at the end of it is Thiram Sukham Asana, and internal awareness tells you so much more than all these explanations outside saying, you internally rotate, externally rotate and things like that. Also, feel the lift in the legs. Draw the thighs upwards, we say that. Earlier, I had put it, or somebody had put it, pull the kneecaps upward. Srivatsa Ramaswamy says, don't pull the kneecaps upward. So there's all these things. Basically, you feel the pull upward, pull the thighs upward, and then what else? When you squeeze the block there, you will feel something in the core. You feel you are engaging the core. That's how you should engage the core. Not too much again. Nothing too overtly done. Just a very subtle feeling. Firm your buttocks. Again, this can be done only in Samasthiti when you can firm the buttocks. But when you are keeping the feet away, there is no such effect possible. So you have to try all these things. I'm just giving the tips, and you will have a little workshop where you will try with each other. So you can make pairs and try. Hips. Do not push your hips to the front. Tilt your pelvis forward and backward and make it neutral, as they say. You can try this and you can try this, and finally it's like a bowl of water where you don't tilt forward or backward, but you may have to tilt forward and backward a little bit to feel that. And there are some schools that say draw the tailbone down. That will actually, I have given a picture there. If you open the picture on the other side, you will be able to see that. We'll work on that before that. We'll talk about, the next step is that. Read about the controversies of packing the tailbone. Basically, some people have extra lumbar curvature. So they will be like this. In that case, it's nice to bring the tailbone down so that their curvature reduces. Otherwise, they are constantly walking with that huge curvature and they might develop back pain. That's why that tuck the tailbone sort of thing comes to fix that situation. But if and that is not the case, then you don't want to do this, because then when you do that, for me, I don't have that extra curvature. If I try to do that, then I'm actually standing like this, which is going to make it worse for me. So that's why there is a picture. Study that picture from neutral to posterior tilt or from anterior tilt to neutral. You would be wanting from anterior tilt to neutral and not from neutral to posterior tilt. But so that is what actually the meaning of tuck the tailbone in, draw the tailbone, point the tailbone down. All these things are for people, especially in the West, with huge people, right? There's so much weight around and they'll be walking like this. And that's why it's like almost like a pregnant woman walking all the time, right? That's why they say do this. Otherwise, if normally you are not having that extra curvature, and if you did this, you are in trouble. Okay, so that's all that discussion is given here for you, not for me to tell you what all is happening, but for you to work on this and discuss with each other and understand some of the subtleties. Draw the belly in, pull the abdomen muscles upward, like very subtle again, right? All of these happen very subtly, and when you, for example, stand like this, that happens naturally. Otherwise, we are standing here like this, with this curve forward, the belly out, the butt sticking out, and the tailbone pointing backward, big way. With that, this is how we like to stand. And just all these are simply just subtle little things to engage yourself. How to engage the core muscles? Notice that when you did this, abdominal organs are lifted upwards and held strong instead of sagging down in the abdominal cavity. This can be done if you engage the core. So awareness improves on your posture. All the organs get the lift as opposed to organs sagging in. And this gives you the lift, and it just overall posture improves. The organ functions also improve because you're no longer sagging them down but giving them that space and lift. And they also develop some amount of tone in their muscles. Like she said, organs have muscles too. That was the first time I heard. I thought organs have tissues. Now, how to pull the spine and breastbone upward? Assume there is a string running through the vertebrae from the crown of the thing, and just you feel the lift. It's nothing really done. Just feel lightness as you stand. All the activities are quite subtle, okay? Now, slow and gentle breathing is the main thing, because when you stand like that, the first thing that will happen is you're holding your breath, because obviously you're overdoing it. But when you're relaxed, you're breathing well. That alone tells you that you're standing relaxed. Okay? So, what are the muscles involved? In fact, in all these cheat sheets, we are giving a bunch of muscles. Hip flexors, extensors, that is quadriceps are involved, gluteal muscles, gluteus maximus is involved, thighs, that is quadriceps, again one more time, hamstrings are involved, okay, anterior trunk, abdominals, rectus, abdominis, and psoas major. We'll be learning all these things as we go. Posterior trunk, back extensors, that is erector spinae for stability is involved. Neck flexors, extensors as stabilizers are involved. Again, as of now, at this moment, you will be wondering what are these muscles, but as we go through the session, you will become more familiar with those. Okay. Now, also it has therapeutic benefits, contraindications, what are the caution aspects, mindfulness aspects, spiritual aspects, and even some of the stories behind these poses are also given there. Take a look and make pairs and try these various little subtle things. Okay.
So I can talk to you a little bit about the pelvis, okay? So if you look at me sideways, okay, feel your bones, everybody stand up. Feel the first bone there that you feel. We call it the hip bone, okay? That's actually it's part of the pelvis, okay? And this bone, and put your hands in the back, okay? And I'm going to stand sideways. Imagine that's a bowl, like Ashwini said, right? So it's a bowl with a round bottom, okay? So if the bowl with the round bottom is filled with water, if you roll it down, you get this position. I call it a BSO, bum stick up. Okay, that's a bum stick up. Now, what's happening is you're pouring the water down, your organs are spilling down, and a lot of people might just be standing like that. This position makes you sort of push your knee back. So you might be hanging on your knee rather than keeping it active. And your foot might turn in because you're just standing flat. So this is a way of really not standing very well. This is, I mean, if you can get away with it, more power to you. But long-term standing like this is not a good idea, right? So your pelvis really, so that's called an anterior tilt. When the pelvis is anterior tilted, the water is flowing down. Okay? Now the same pelvis you roll it, so you have to be a little bit of a belly dancer for this. You're not doing anything to your knees, you're only moving your pelvis. Okay? Now you go back, keep going back. That is the extreme position of tucking your bottom. You end up grabbing your buttocks. That's also not good. And here, imagine the water is kind of flowing back. Maybe not as much as it falls in front, but a little bit more in the back. Now you want to keep that. You don't want any water to fall. So you find that spot in your body that keeps that water level. It's somewhere between this BSO and this other extreme position. And I say that because some people have flat backs and some people have BSOs, right? Different. So their basic positioning is standing like this. Some people, the basic position is standing like this. Both are extremes. You got to, and sometimes they have to. Someone with spinal stenosis, if you tell them to walk, to be a BSO, they might start getting pain in their back. So you really, neutral position is personal to each person. I cannot tell you what your neutral position is. You have to really try it out. Go through that range of motion and say, you know what, that feels really bad. And that doesn't make anything work. And this feels, this hurts. So let me find out. Maybe for me, the neutral position is more like this. Maybe for you, the neutral position is a little bit more. So everybody might have a different neutral position. You've got to find your neutral position. That neutral position, you should feel balanced. Okay, that's the pelvis. But even before you do the pelvis, really pay a little bit attention to your feet. Pick up your toes, spread them, and lay them on the floor. Right? Very nicely. All your toes are straight. They're not curled, if you can help it. Okay? And now when you press them down, don't press them for like your life depends on it. Okay? Like Ashwini said, really take it with a pinch of salt. What I tell people is, imagine if you're cooking, the gas is on the high flame, it's like gripping. Okay, medium flame, you're still gripping. Low flame, it's touching and holding down there. That's low flame. You always should be low flame with anything that you do in yoga. Because low flame makes it efficient. It makes you expend least muscle energy. Your body starts to understand what you're doing and it really starts tuning in. If you do too much, everything focuses on this and you get a phenomenon called irradiation that makes everything overwork and you get tired really fast. So standing is an activity that should be in balance, and when you're in balance, you're using the least muscle energy to get the best response. And that's always our quest in life, right? To do the least amount of work and get the maximum, right? So same thing with our, so you do that, and then you see the foot can roll in. So really tune into that and open up your arches. Again, you open up an arches and make a small cave for your arch. Everybody's arch is going to be different. Okay? What I tell people is make a cave for the ants. Don't make a cave for the elephants. Because that's too much. That's not balanced. You do have the 3-point connection. The two ends of the feet here and here, it's a post, and then you have the heel is a post. So that you have your weight right in the middle of the three points. If you're pressing your, I remember Ashwini, you talked about lifting up the toe, and you might find if you lift up the toe, you might find it throws you off. It's because you're pressing your big toe down too much. Look at your shoes that you're wearing, and if you see that part is really dented, that means you're walking with the law. Every time you walk, you're pressing your big toe down, and you really should be balanced between the two sides. So keeping that, becoming conscious of how you stand with slightly opening up your, so you're not standing completely on the outside of your foot, you're balancing it out. But you are picking up your arches, ever so slightly. Again, low flame, everything is low flame. You're not, like, that's not sustainable if you do something for, at a high strength level. You want to keep it low and then you do this. So this is really important. And then from there, you just feel automatically, you bring your attention to your knees. Are you locking your knees? Are they going back and are you hanging on them? Soften your knees a little bit. Don't bend them, but soften them. You'll understand the meaning of softening once it's a hard end when you go all the way back and it feels hard, versus you soften it, it comes slightly forward, ever so slightly. But that when you soften it, you're actually engaging your muscles better. Okay? You don't have to say pull your kneecap up. That's too much. Because what you're going to do is you're going to really engage your quadriceps. And then your body's going to get confused because you're looking for a balance. You're not looking for one-sided stuff. Right? If you pull your kneecap up, means you're telling your quadriceps to work. How about your hamstrings? You've got to balance out the two. So you keep it. You keep it a little bit tight. You tighten your buttocks first. So everything that you do it first. And then you say, okay, I'm going to back off. But don't back off 100%. Come to that 10% level where your buttocks are engaged, but they're not over-engaged. Your quads are engaged, they're not over-engaged. Your pelvis is engaged, you hollow your stomach a little bit, and then that's too much, that's not sustainable. Back off, but don't back off 100%. So a little bit is still there while you're holding it. Lift your chest up, roll your shoulders down, and then you may do really well with this, but your neck might be like this. Right? You got to get your ears gently coming over your shoulders without sticking your chin up. You want a very slight double chin so that the whole head and neck comes back over your shoulders. And see how long that's made. You won't be able to sustain it for a long time, but slowly with practice you will find it get better and better. And all the muscles that need to be engaged will automatically be engaged. Just by start off with your feet though, with the right form.
Alright, so you have 5 minutes, just pick one partner and try all these. And one is feet apart position, the other is samasthiti. Yeah.
Feet apart or feet apart?